It has been around for decades. There have been some technological changes in it which have really improved the outcomes and really helped make it a very, very good treatment for prostate cancer. It's used around the country to treat localized prostate cancer. By no means do I think it is the end-all, be-all, treatment that everyone should have, but it certainly offers some advantages in particular patients. But it takes usually about an hour to do in the operating room. It is an outpatient procedure, so people are able to go home, usually after they've recovered from anesthesia. And what we do is we freeze the prostate down to at least -60 degrees in a very controlled fashion, and it causes the cancer cells to die. I think part of it is, a decision that is reached with the patient and the treating physician. I think that by and large, if you are, under 60, at least in my practice, I usually tend to recommend surgery to just remove it. And that's just because it has been a tried and true, treatment option, and I think it works great. I think that with cryoablation, again, it could treat and cure the cancer, but I think your risk of erectile dysfunction in that group of people is higher with cryoablation than it would be with surgery. You could have erectile dysfunction with either treatment, but if we do nerve-sparing surgery to remove the prostate, the risk of erectile dysfunction might be, 40%, depending on which study you look at. With cryoablation, it's going to be higher. It's going to be closer to 90% because the nerves that are responsible for erections can also be frozen with the prostate. There are times when we do nerve-sparing cryoablation where we know where the nerves are and we put temperature probes near the nerves and we can make sure they don't get cold, but then you're risking not getting the cancer. I think one of the newer exciting alternatives for treating with cryoablation is focal cryoablation, and with the advent of MRIs for localizing prostate cancer, it gives us the option of going in and just freezing, one lesion in the prostate that could be cancer, and the MRIs would allow us to follow that area and make sure that it doesn't look like the cancer has recurred.